I'm Dr. Annie Varughese, and welcome to another episode of Best Docs Network, where we feature some of the finest doctors in Houston. Today, welcome Dr. Guy Lewis, who specializes in cosmetic dentistry.
I travel quite a bit for a living, and noticed in an airplane magazine that Dr. Lewis was advertising for cosmetic dentistry, and never gave it another thought until I tried to get my teeth fixed back where I live. And I found that I had to wear braces for quite a few years, and that wasn't a good alternative for me, so I did some research. I don't know if there's cosmetic dentists up there, I'm sure there are, but I just didn't investigate it. But I did investigate this one and thought, wow, this looks like a good as any, and if he's going to advertise in an airplane magazine, he must be pretty good.
So he sent me a lot of pictures and stuff before he came, and I knew I could help him out. And so he came in one night and got here late, and we stayed and took care of him, prepared his teeth, made him some temporaries that looked fabulous, let him go home, and then came in and we put him on, and he's just been really happy with them, and it made a big improvement on his smile.
I spoke with Christine quite a bit, more of a consultation type of format, because obviously I kind of skipped a couple of steps on the process because I live so far away. But very helpful. Christine kind of explained the process, what was done, what's going to be done, how it works, I mean, and getting the quotes and the pricing and everything. So it was very consultative, very helpful.
We did prep veneers on him, but it was not extensive. I mean, just because you have to prep the tooth doesn't mean you have to take it down. A lot of people think, oh, you're going to have to take my tooth down to a little nub or something like that. No, sometimes it's just a matter of a little smoothing that is very, very minimal.
I was getting pretty self-conscious of when I would laugh or smile of putting my hand over my face, because I was just, hell, that's funny, and something like that. And what I found is it's somewhat liberating to the point where I find myself not doing that anymore, which is nice. I mean, actually, when I smile for a picture with my family and my kids, I actually smile instead of, kind of half smile it. And they were always making fun of me for that. So, very happy with the results. The staff is very professional. That they obviously know what they're doing, but the results are fantastic, really are.
It doesn't have to be a trip to the dungeon. It doesn't have to be uncomfortable. I would just say, come in and experience it, see for yourself. It really can be very pleasant.
Well, I was having extremely heavy periods that were just getting worse and worse, very painful, just a lot of discomfort. So the only real option for me was hysterectomy or live with it until I go through menopause. And I'm young enough that I thought it was disrupting my life.
So I tell you, when I started in medicine a while ago, most hysterectomies were done abdominally. There was a large incision made from hip bone to hip bone. Patient would be in the hospital for a week, and her recovery, a very painful recovery, 6 to 8 weeks later. But what's fantastic is over the last few years, women have choices. We have technology available that allows us to do big surgeries through little incisions. And it depends on the patient, depends on what her symptoms are, depends on what her needs are, and what her wishes are.
Oh, it was so easy. I woke up in the recovery in a chair, and within an hour and a half to 2 hours, I was up walking to the bathroom. No pain at all. Went home in the car, and really I was up and walking around within, just that day I was up walking around, on my own.
It's a very new procedure, and there are very few surgeons in the country that perform it. Aesthetically, it's very pleasing to the patient because the surgeon uses one incision only. It's a very small incision, approximately 2 centimeters in length, and we hide it in the folds around the belly button.
Well, it was a whole lot easier than I expected it to be. I'd had 2 C-sections in the past, and those were extremely painful procedures afterwards. And this hysterectomy, I went in the morning, did the preparation and had the surgery, and I was home by 3 o'clock in the afternoon, walking around fine. I was fine.
I think most young women, especially those who exercise and take care of their bodies, want the option to be able to hide their scars. You don't have to show them. So with the less procedure, I'm able to give them that option. I'm able to allow her to treat her problem while cosmetically achieving superior results.
Jack from Tomball has a question for Dr. Annie. How can airplane travel cause clots and death?
Long travel can cause venous flow to decrease, so therefore the flow in the legs can kind of pool and accumulate and not come back up to the heart. When that happens after patients are sitting for long periods on an airplane, clot can form because the blood becomes stagnant. To prevent that, we tell patients to walk the aisles of the plane, exercise the legs even while sitting, and try to stand up intermittently throughout the flight. This will protect the patient from having clot formation. What happens when the clot forms is when the patient finally leaves the airplane and gets to their destination, clot can move and go up to the lungs and cause sudden death from a pulmonary embolus. Very critical to know about clot formation, very critical to prevent it, and easy to prevent by just moving. Actually, sometimes wearing hose will help, and knowing the risk factors of flying can prevent a problem when you get to your destination.
The difference with the sleeve compared to the gastric bypass is that there's no malabsorptive component to the surgery. It avoids some of the long-term issues that can happen with the gastric bypass. In particular, there are very few vitamin and mineral deficiencies later because everything goes down the normal way. The gold standard operation, of course, is the gastric bypass. It's been around for 50 years. It has very predictable weight loss. What we're seeing is patients who are a year out from surgery who've lost 60, 70, or 80% of their extra body weight.
Well, I had what's called the Roux-en-Y, is where they make a small pouch out of the stomach and they divert part of the intestines so that I have a little bit of malabsorption. So I have to supplement my diet with several vitamins that would otherwise not be absorbed through part of the intestines.
Jean had gone and had a lap band operation done previously with another surgeon. And like some of the lap band patients, what she'd experienced was a frustrating cycle of having the band adjusted to a certain tightness and getting some difficult symptoms from that, only to have it loosened to make those symptoms go away, and then losing a little bit of weight and then gaining it back. And she has lost somewhere in the neighborhood of 2/3 of her extra body weight from the level she was with the gastric bypass. 2/3 of the weight has gone away.
My friends comment that I have more pep in my step and I'm able to work more days in a row and longer hours and not feel fatigue.
I looked at the breakdown for the last 12 months and it appears that about 74% of the patients are choosing the laparoscopic sleeve gastrectomy. Most of the rest of the patients are choosing a gastric bypass. And we're doing very few lap bands currently, mostly because the weight loss just isn't as predictable with the lap bands and there are some long-term issues.
Go to the seminars, especially Dr. Marvin, who is very open, explains things in a very simple way for everyone to understand. We have numerous support groups here in Houston, and that has been my main success.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
I was one of those individuals who've suffered from migraine since about the age of 8. And in 2008, I started to get very strange headaches. They were coming much faster. They were lasting for weeks on end, to the point that I was doing rapid infusions. I had 3 trips to the emergency room. On the 3rd trip, I lost part of my eyesight. So I went to see Dr. Reed. I was honestly a very skeptical person. I had no intention of having anything metal put in my body ever.
She came in like a lot of patients, still with these devastating daily headaches. Had been to excellent doctors. Most of our patients have been to excellent doctors, but they're still at their wits' end.
The first time I met with Dr. Reed, we met for 2 hours. We tried a couple of other things first, and then finally he said to me, look, Victoria, I think the only thing we can do for you is the neurostimulator. The trial itself was like, it all got turned off. I didn't know what pain-free meant until I had that happen. And it was like the clouds cleared, I could think. We went through the procedure. I had the 4-lead stimulator implant.
Right away, she did well. Her headaches came under excellent control. And it's always a joy to have her and her husband come back to the office, just telling me about, you know.
Eating in your whole day, and that means you're on emergency. And when you're on emergency, there are certain chemicals that your body produces, and those chemicals can cause heart disease and other diseases. So eat breakfast, have your physicals done every year, memorize cancer's warning signals. Of course, don't smoke, lose weight, exercise. All of these things you know about, they'll make your life longer and they'll make your life greater in quality. You don't want to live long and live bad, you want to live long and live good. Also, eating anything that's red or green is good, and by that I mean vegetables, red and green vegetables. Yellow also, so kind of use your color wheel to get you on the right vegetables. Lots of fatty food, not so good for you. Even barbecue increases the problems with colon cancer if you eat barbecue all the time. So think smart, do what your mom used to tell you to do about diet and exercise, and you should do well.
For more information about any of our doctors on any of our shows, go to bestdocsnetwork.com or email us at info@bestdocsnetwork.com. Now let's meet vein specialist Dr. Peter Morgan.
Debbie presented with severe swelling and large bulging veins in her legs, one leg much worse than the other. She had coexistent, severe, very advanced osteoarthritis in her knees, so she really had some big problems with both of her legs.
Every morning and every night I would measure my ankles and just below my knees. I would have a difference of sometimes as much as 1 3/4 inches between morning and evening. And when I saw Dr. Morgan, he discussed the options with me. And then, as I said, having double knee replacements, and 3 doctors whom I highly respected all said, get it done before you have your knee replacement because it will do so much in aiding the healing.
Before having her knee surgery, she came in to us to have her veins treated. We did ablations on her legs. Her swelling improved, her varicose veins improved substantially, and her legs felt much better, and she ultimately went on and had knee replacement.
I don't go to bed at night with my legs aching. I don't go to bed at night just sometimes almost in tears if I've had a real active day, because my legs were so swollen and ankles were so swollen, and it made a huge difference for me.
The patients that I dreaded seeing previously in my practice. Now I enjoy seeing them because I know that almost all of them have been seen and treated by numerous other physicians unsuccessfully, and I know that I can treat them successfully, not only for their wounds, but if they have swelling, pain, bulging veins, heavy, tired legs, all of those things can be successfully treated.
About a month ago, my great niece was over and wanted to ride bikes, and we ended up riding 4 miles that day. I could not have done that previous to not having the vein surgery because it's made a big difference in my level of activity.
Coronary artery stenting is a part of interventional cardiology that I absolutely love. It's been around for about 30 years now. Initially, the great giants of cardiology formed a cardiac stent, which is just a metal mesh that we place on a balloon catheter, place it into the coronary artery that's obstructed, open it up, leave the stent, and remove the balloon and the catheter. Easy procedure, but years ago it was quite difficult, and catheters were larger. There were a lot of bleeding problems, but now the catheters are quite small. The procedure is fast, done quickly and without much discomfort at all for the patient. If a patient presents with coronary artery blockage, they can go to the cardiac catheterization laboratory, have the coronary angiogram procedure done, and then if there's a blockage, we can place a stent right at the same time. Coronary stenting has protected many patients from going to cardiovascular surgery, has improved lifestyle, and many patients have gone without symptoms for many years because of coronary stenting. We thank the developers of coronary stenting, and we look forward to a future of great developments with regard to the coronary stent.
Yeah, I lost a couple, and the rest of them started getting loose, and it was something that took about 5 or 6 years to happen. It just suddenly came on, though.
Yeah, George, his teeth were in an end stage in that they were decayed, and he also had periodontal disease, bone loss around his teeth. His teeth were chronically infected. They had become loose. Also, there was a cosmetic problem with his teeth, and George is a very outgoing person and likes to smile and has a great smile, and so his smile just didn't suit his character, not to mention the health of his teeth. It was really driving him down.
I was kind of getting to the point where things that required real chewing, particularly in the back of my mouth, was getting more and more difficult.
With George, what we did was removed his teeth. Now in him, we focused on his lower jaw. And from a financial standpoint, many individuals decide to maybe focus in one jaw versus the other. Now granted, with him we could have done both of them simultaneously, but for whatever reason, and oftentimes it's schedules, their busy work schedule, also finances, that they'll sometimes stagger the case to suit them better. And with George, we focused in his lower jaw, and we removed all of his teeth, upper and lower, but we put the implants immediately in his lower jaw.
I'm feeling fine now. I'm back to the point of eating anything. There's no problem. We're continuing on. I'm not quite through with all the procedure, but just about.
And that is a misconception that we're seeing right now with the advertising, where it talks about get this all done and completed in one day. Reality is the final is usually done later down the road once the body has fused to the implants, and the textbook answer for that is at least 3 months, but it can be as long as anywhere from 3 to 6 months. But the standard of care is to keep the patient in a provisional, a prototype, if you will, for a period of at least 3 months.
According to my experience, no question about it. Don't be waiting on it. The earlier you start some treatment, clearly the better.
Coronary disease is a type of vascular disease where plaque coats the inside of the vessel to the point where there's a growth, and that's called stenosis. The number one problem with regard to formation of plaque is cholesterol. So we have different types of cholesterol, LDL cholesterol, We have HDL, which is the good cholesterol, LDL being the bad. Triglycerides are another bad cholesterol. So it's very important to do advanced testing of the lipids.
Back in 2000, I went working, had some pains in the chest, went to my general practitioner. He examined me and said, "You need to go see the cardiologist today." Made an appointment for me with Dr. Varughese, and when she examined me, she said, "Just stay right there. You're going to the hospital."
The case of Thomas Cole is quite interesting. He came at the beginning of my practice years. I've been practicing for 18 years now. And Thomas Cole came as a new patient and just complained of intermittent chest pain. We proceeded to take care of him, and he proceeded to die on the table and had no heartbeat. So we, of course, started resuscitative measures immediately and quickly transported him to the cardiac catheterization laboratory. Found a severe blockage in the right coronary artery, and that's why he had become hypotensive. His blood pressure had dropped, his heart rate had slowed down to nothing, and it had stopped. So in the office, I pounded his chest and started CPR, and then we took him to the cath lab.
I was very lucky. I mean, if you're going to have that kind of thing happen, being in a cardiology office is one of the better places to be. The thing that's most amazing, I think, about Dr. Varughese is her concern for her patients and her constant drive or constant searching for things to help them, not only when they've had the heart attack, but help in prevention of the heart attack. Her personality of her patient care is phenomenal.
The symptoms is I had headaches, a lot of congestion, infections in the throat, a lot of mucus in the back, ear headaches, so much stuff going on.
Janice Martinez is a patient who came to my office complaining of nasal obstruction, facial pressure, constant headache. She has been treated under multiple medication, including antibiotics, antihistamine, nasal spray, without really without any good success.
I went on, but then I started getting infections, and I was on antibiotics for 4 months in a row. They kept giving me, so I was like, this is not good.
So when we examined Miss Janice Martinez, we found that her natural sinus drainage pathway, it's obstructed by chronic inflammation, chronic infection. So we offer her the option of doing balloon sinuplasty.
The best part was the breathing. I could breathe again. The headaches, little by little, started going away. Now when I sleep, I would breathe real loud. My husband will always say that, and I don't do that no more.
So when you have a chronic sinus disease, that passage, it's obstructed, it's narrow by chronic inflammation, chronic infection. So what we do is we put a small balloon in the passage, and we open up, you inflate the balloon and open up the natural passage, preserving the normal anatomy.
And I don't sound like I have cold all the time. Before I was like sick all the time. And now I'm doing great. I could go out, do everything, and I feel good.
One of the advantages is the quick recovery. There's really no downtime to balloon sinuplasty. The procedure can be done in office, under local anesthesia or the topical anesthesia with some nasal spray. There's not really a recovery time for balloon. The patient can go back to her daily activity the next day, and compared to a traditional surgery, which the recovery can last to a week.
We have an epidemic of diabetes going on in America at this time. Diabetes is high blood sugar. Normally, your blood sugar should be less than 100. We define diabetes as a blood sugar of 126 or higher. If you have a blood sugar of 100 to 125, that's called pre-diabetes. If you don't do something about it at that point, it will develop into diabetes almost for sure. What's bad about having diabetes? Well, it damages every blood vessel in your body. That can result in vision problems, even blindness. It can cause kidney failure and heart attacks or strokes. None of those are good things. To prevent or treat diabetes, the best thing you can do is lose weight. That will help the most. Also, eating an ADA, that's an American Diabetes Association diet, will help. You can find that on the internet at multiple websites. So if you have high blood sugar, exercise, eat right, and things should get better. Remember, sugar is sweet, but you don't want to be too sweet.
Prevention and therapy of osteoporosis is one of Dr. Meredith Morgan's specialties. Dr. Morgan offers some suggestions that could help prevent this disease.
If a woman's normal, a healthy lifestyle should be adequate. The question about diet, nutrition, and exercise, part of life would be an active lifestyle. Weight-bearing exercise, say 5 times a week for 30 minutes, is good for cardiovascular, and it's good for the bones. So walking is great. So if a person can do that, that's the ideal for the bone health. Therapy is indicated on a risk factor. If there's been a fracture, it's obvious the disease exists. If there has not been a fracture, but the absolute risk projects to over 20% for a major fracture of the spine, arm, wrist, or a 3% 10-year risk of the hip, then drug therapy is indicated.
Dr. Morgan can adjust his treatment depending on his patient's lifestyle.
There are basically 2 groups of first-line therapy. The bisphosphonates, to use a big chemical phrase, and denosumab, which is a type of immune therapy. These have been proven to be effective and significantly reduce the risk of fracture. Highly, highly preferred to obtain our calcium in the diet. Just make it really short and easy, about 1,200 milligrams of calcium a day. In terms of nutrition, this is very serious. There is controversy, but there's enough evidence to indicate that a person who tries to treat osteoporosis only with calcium supplements or calcium and vitamin D supplements may have an associated 30% higher risk of having a coronary event, a heart attack. It's mainly theory as to why this would happen, and there are some people that don't believe it would happen, but in terms of the alternative managements of the disease or the high risk, we're talking about nutrition, supplements in a reasonable dosage, and the lifestyle of exercise and fall prevention.
Thank you for joining us for another edition of Best Docs Network, where we feature some of the finest doctors in Houston. For more information about any of our doctors, go to bestdocsnetwork.com or email us at info@bestdocsnetwork.com. For Best Docs Network, this is Dr. Annie Varughese, and I will see you next time.